There's a new study out from Cornell and Harvard researchers published in the National Bureau of Economic Research, and they looked into how Medicaid has affected people's lives in the long term. So there are the obvious short-term benefits of healthcare to low-income folks, which is what Medicare is. But the long-term effects are even more interesting. They found out that, quote, children in the 1980s and 1990s in states that broadened their public insurance programs had better health, and that, in turn, led to substantial long-term educational benefits. They say expanding health insurance coverage for low-income children resulted in fewer high school dropouts, higher college attendance rates, and a better likelihood of attaining a bachelor's degree. And then later on, that also led to higher income. So to give you more specifics, quote, states that increased childhood Medicaid eligibility by 10% reduced high school dropout rates by 5.2% and increased college attendance and BA attainment by 1.1% and 3.2%. So the basic takeaway from this is if you give people health care, and in this case specifically low-income people health care, they're going to be more successful. Now, of course, the rebuttal is, well, does causation necessarily equal correlation? And the answer to that is no. But at the same time, is healthcare at least one piece of a giant puzzle that leads to a greater chance of success? And the answer to that is absolutely. I mean, it's much easier to do well in life when you know that you won't go bankrupt from getting sick. And then also when you get sick, you know that you're going to get the help that you need. I mean, that's got to be a giant weight off your shoulders, and it allows you to flourish much, much more. And to me, the point of this study, the takeaway from this study, is that it's irrefutable evidence in favor of progressive policies, because it shows that when you give people this minimum baseline of a living standard, it acts as a springboard. You know, I always said, look, I have no problem if somebody actually chooses to essentially be a slacker in their life. I don't want that person, doing just as well as somebody who's busting their ass. I don't want them to make the same amount of money. And I think most people would agree with me on that to a certain extent, the idea of a meritocracy makes sense, that the harder you work, the further you go. Okay, I think we all get that. But the issue then becomes, well, shouldn't we at least have a minimum standard where, as a society, we feel comfortable, like, okay, well, if you don't make it from here, then it's your fault, See, that's what the conservatives do today, is that they'll look at people who don't make it today, and they go, well, it's your fault, blame yourself. But you can't do that yet. It doesn't make any sense to do that yet, because people's starting points are wildly unequal. Are you seriously going to sit there and tell me that Mitt Romney's sons have an equal chance of making it in life as a kid who's born, a crack baby who's born in the middle of Harlem, okay? No, they don't have the same shot in life. You can pretend that they do, and you could act like we have equal opportunity in America, but they don't have the same opportunity because one has all the resources ever, and the other has none. So then what happens is it becomes society's choice. Either we set up this minimum living standard where we can rest self-assured that everybody's getting an opportunity, or we don't do that, okay? And other modern nations have decided, well, let's do that. Let's set up that minimum standard. The U.S. has said, not really. Like, we'll give you a little bit. Some people that are low income, maybe you'll get health care. Maybe you'll get some food assistance temporarily. Maybe we'll give you a job training program if you're struggling. Maybe we'll give you unemployment for a little bit of time when you're unemployed. But by and large, no, that even if you work full-time, you don't get a living wage in the U.S. if you're making minimum wage. So we haven't set up that minimum standard. And like we've argued, I mean, all it really takes is give people health care, okay, set up a good infrastructure for people, give people education, and, have just these basic bare minimum safety nets around them. Make sure that when they work, the work is rewarded with a living wage, and then that's it. Then it's on them. Then you can work your way up through the ranks, and then it's legitimate to say, oh, you didn't make it far? Well, maybe it's on you. But as of right now, that's not the case. It's not on you. And this is showing it right here, that if Medicaid was expanded and other people who were low income had that safety net, a higher percentage of them would succeed. That's not me speaking, that's the numbers speaking. It's irrefutable.